Hello, my name is Cassandra Romas and welcome to 30 Medical Minutes. Today's topic will be one of vital interest to almost every lady and even some men. Dr. Paul Carniol, a plastic surgeon and attending physician at Overlook Hospital in Summit, New Jersey, will be discussing facelift without surgery. Dr. Carniol is going to explain that certain procedures can be used to restore a youthful look and can improve one's appearance with a natural and not artificial expression. We will learn that there are different methods that can be used, usually for different areas of the face. Primarily these are lasers, fillers, and Botox. Dr. Carniol will also explain that if one is considering cosmetic surgery and/or procedures, then that an experienced physician with an artistic eye is the one who should be engaged for this work. So stay tuned for this really interesting and exciting show. And now let's welcome Dr. Carniol to 30 Medical Minutes. Thank you for joining us, Dr. Carniol. It's a pleasure to have you.
Thank you, Cassandra, for inviting me on the show. I appreciate it.
Okay, Dr. Carniol, let's start off by your explaining a little bit about who you are and what your practice is all about.
I'm a plastic surgeon in Summit, New Jersey. I diagnose and treat skin cancer, deal with people with trauma, deal with people with scars and deformities, and also many cosmetic issues. We have in our office over 10 different lasers to take care of people, a range of fillers, a range of other devices and procedures that we can perform to make people look better.
Okay, so you have a wide range of things that you take care of as a plastic surgeon, and I hear that you talk about skin cancers and trauma, but let's focus today on the fun topic of cosmetics, the cosmetic surgery.
Certainly, good idea.
Cosmetics, surgery, and without surgery.
Yes.
Okay. So we've established that we're going to be talking about this because of the aging process. Why don't you explain to me and to our audience, Dr. Carniol, what causes aging? Why do we age? Why does it show up?
Okay, well, I'll limit this to just discussing facial aging and the changes that we all see when we look in the mirror.
Okay.
And it's very interesting, but there are a number of things that contribute to aging. First of all, there's what we call photoaging, and that is sun damage. Sun damage can be a change in skin color, give you brown spots, give you those spider veins on your face, give you redness, make the skin thinner, make it looser. You lose elastic fibers. Then we have other changes to the skin itself that just occur within the cells, actually, which you lose things within the cells we call hyaluronic acid and things like that. We also have effects on the skin from underlying muscle where you get folds induced by muscle. And so many different factors affect the skin besides the natural aging changes of the skin cells themselves. Then you look at the soft tissue and the bone of the face. And what happens is, and we all sort of know this, but we don't really think about it, is that you lose volume in your face as time passes. And you lose that volume in the thickness of the skin. You also lose it in the fatty tissue in your face and the other related soft tissue structures and in the underlying bone. And I thought a great example of a young face was actually a picture from Andy Warhol of Debbie Harry. This picture actually, if you look at it, you'll see that she's young, she's a very full face and smooth skin as well as full lips. And that's an appearance that you associate with youth. So over time, what happens is when you lose all that volume and you get the skin changes, now it's the skin look different, but everything sort of sinks in a bit from loss of volume. Years ago, we thought it was all from gravity, just gravity pulling it down, but it's actually probably gravity is a component, but probably more important is the loss of volume and changes to the skin itself.
Okay. Wow, you just gave me so much information there, Dr. Carniol, that I'm going to step back for a second and just try to process this. So there's changes to the skin, there's changes to the underlying structures of the skin. or the face, including the bone.
Yes.
So we have skin changes, and we have bone changes, and we have underlying structural change.
Correct. You can see the effect of bone, especially, for example, around the lips and the lower face, where you can actually judge, say, a lady's age just by looking at the structure of her lips, the skin and the pink part. We call the skin above the pink part of the lip also lip, because over time it all seems to flatten and sink in. And a lot of that is due not only to soft tissue change, but also changes to the underlying bone.
Okay. Wow, that's very interesting. So why don't we go back to what you were talking about with skin? I'm going to just delve a little bit more into what causes the changing in the skin. And you mentioned first and foremost exposure to the sun, wind, I presume, as well. So what happens when the sun and wind and other weather changes happen on the skin? What does it cause again?
Okay, a lot of it, we even call it photoaging, because the
Photo meaning light.
The light, exactly. The sun makes your skin thinner. You lose elastic fibers. You lose collagen. You also get irregular pigment on your skin. You can get dark spots, light spots, irregularity related to that. Then you can also build up all these little spider vessels. Some people don't make these little spider veins on their face, but other people do, and the sun actually increases the rate of those.
Okay, so I can understand the brown spots and the wrinkling because your skin gets dry, you know, when you're out sun tanning, and I have a feeling that you're not a person who proposes that you can go out and suntan.
Well, I suggest that people do go out, because I think going